Hello, everyone. My name is Cixin Wang. I am an associate professor in school psychology at University of Maryland, College Park. I'm going to do a presentation for MCPS Mental Health Fair in 2020. The topic is how to talk so your teens will listen, understanding mental health needs among Asian American youth. First, I want to thank many collaborators on this project, including Mental Health 360 Project in Montgomery County, Asian American Health Initiative in Montgomery County, as well as the Bullying Prevention and the Mental Health Promotion Research Team at Maryland. And just want to share some information about the Asian American Studies program at Maryland. You can see that we have put together some newsletters for parents to talk about some parenting tips using research and evidence-based research findings in psychology. We are in this COVID together, and recently American Psychological Association has done a survey and find many parents in the US are very, very stressed out. And parents really are stressed out about how to keep kids healthy, as well as how to help kids with schoolwork. But you are so important for your kids' health and learning. And you deeply care about your kids. That's why you are here today. So thank you so much for being here. And but please do take care of yourself first. And if we are not taking good care of ourselves, it's hard for us to take care of our kids. So the intent for today's talk is not to blame parents, it's really to present an alternative ways to think about parent-child relationship. Here are some simple examples of self-care. And again, just like when we are taking an airplane ride, we see a video say you need to put on your own mask before you put mask on someone else. And we need to take care of our mood and our health before we can take care of our kids as parents. So those are some simple suggestions, and what self-care look like for each parent will be different. And we need to remember taking care of ourselves is not selfish. It's actually doing, we are taking care of ourselves in order to help our kids better. And now I want to present some data about mental health needs among Asian Americans. So in the 2016 statistical report in the US, we find that suicide is the first leading cause of death among Asian American adolescents ages 15 to 19. And this rate is actually higher than Hispanic, Black, and Hispanic youth. And among other ethnic groups in the US, suicide is the second leading cause of death and for adolescents within that age range. And if we look at Asian Americans together, like regardless of age, we find that second generation Asian Americans have higher instances of mental health disorders, such as depression and anxiety, compared with non-immigrant, non-Hispanic whites. So what does that mean? So meaning that if you and your kids are first, second generation immigrants, so Asian Americans tend to have poorer mental health compared with non-Hispanic white. And also among Asian Americans across age range, we are less likely to seek mental health services and support at school as well as in the community. And when kids and parents do seek help, because they wait for a long time, making it hard for psychologists to provide effective treatment and to help the kids. And so that's the data with Asian Americans. This is national data. They actually find that in a recent report published by National Academy of Science, Engineering, and Medicine, they find that students in high achieving schools are now considered as an at-risk group. So for mental health concerns, the reasons can be complex, but it's possibly related to the pressure kids are under in order to build their resume and take very many AP classes and to be successful academically. As a parent myself, I know that as Asian Americans, we want to support our children academically. But it's important to think about how can we support our children academically without putting too much pressure on them. We don't want them to be at risk for mental health difficulties. One of the solutions in this article, they interviewed the psychologists, and one of the suggestions they provide is that Dr. Luther said that the best way to protect the child is to keep the lines of communication open, set limits, and follow through with them, but also important to help your kids feel unconditionally loved so their self-esteem does not rest on their accomplishments. So this quote is from some kids we work with. They say that some kids say that my parents love me no matter what. And and that's what's really helpful for them. So do your children know that you love them unconditionally? So will you still love them if they say they want to flip a burger, they want to work in a bakery? So those are things that we really need to think about. And if we do love them unconditionally, it's important to communicate that to the kids. So during COVID, a lot of parents share this common conflict with their kids about screen time. So kids always say that I'm bored, I want to play video games, or they might be playing video games throughout the day. So then parents are really concerned that you are wasting your time when you play video games. You need to spend more time on your schoolwork, or let me give you other things to do. And our kids might say that I'm not addicted to social media, I'm just addicted to my friends. So during COVID, kids are under a lot of challenge that they are not able to see their friends, they're not able to go to school. So this is hard. I think it's important for parents, for us to understand the challenges kids do experience. And this mom used a very good way to communicate with the kid. Let's read this together. So it said, mom says, I know you want to spend time with your friends online, and I'm worried about your sleep and your mood. Please tell me how you can get off the screen because getting enough sleep is really important. Let's brainstorm together. What else can you do for fun? What else can you do to maintain contact with your friends? So we say mom did a great job because the mom is using I statement, right? You say, I notice, I understand, I am worried. Instead of say, why are you on the phone all the time? Why do you play Fortnite? Again, you've been playing for 4 hours today, right? So when we use you statement, it's criticism based. But when we use I statement, and it's more likely to promote a better communication and a better relationship. And also in red, the word and. So a lot of time we say, I know you want to spend time with your friend, but you need to go to sleep, right? Whenever we say but, kids know that there's something negative is going to happen. But when we use the word and you tend to be, you are not suggesting some negative things. And in order to really help our kids to listen to parents, to have a good relationship with parents, parents need to think about our own basic needs as well as our kids' basic needs. So when kids are playing video game is fun, right? And it fulfills many basic human needs for our kids as well as for parents. So first, that when they play games, nowadays, a lot of kids play game with their friends. So they say, okay, let's meet at 8 o'clock. We go on to Fortnite. We'll play this game together. We are playing this battle together. So it's a sense of belonging. They feel they are part of the group and they are doing big things to win this game, to fight with the enemy. So there's a sense of belonging. There's also a sense of accomplishment. So if they can win the game and they feel a sense of recognition, success, sense of power, and it's fun, right? During COVID, they cannot go out, they cannot go to the farm, they cannot do trick or treat. So there are not many fun things for them to do. So as human beings, we do need to have fun, to have laughters at home, to have enjoyment in our life. But it doesn't mean that video game is the only way. So as parents, we need to agree that it is fun to play video games. I like to play sometimes too. So, but are there other things we can do as a family for fun? So maybe we can play Wii Sports, or we can do other fun things. And so, but we cannot do this alone. We need our kids. We need to involve kids in this conversation to find out other fun things they can do with you or by themselves and fulfill their basic needs. And also, kids want parents to be proud of them. So kids want to be recognized by the parents for parents to think positively of them. So when we use a lot of criticism and we get into argument with them about video games, and it's not meeting their basic needs. Of course, survival needs, staying healthy, not avoid the spread of virus is important. And it's also important for kids to feel a sense of autonomy and freedom. So they want to be able to make some choices and to make decisions independently. So sometimes involving kids in the family decision making and give them opportunity and give them some autonomy to make decisions in terms of what game they want to play together as a family, maybe what movies we should watch together as a family. That will also fulfill some basic needs, but also fulfill some needs for fun. So while talking about children's basic needs, parents might say, okay, I want my kids to be successful. I want them to have a job, and when they are adults, I want them to be successful. But we also need to think about how children succeed. So this is a new US News best-selling book. The author did a longitudinal study, collected interviews from teens and adults to figure out how children succeed. So what are your guesses? So the answer may be surprising to you. So children succeed with character, not test scores or IQ. So it's really not about whether they get 100% on the calculus test or what's their GPA. So research actually find that children's grit, they are persistent, they are self-control, zest or passion, social intelligence, are they able to work with a group, and the gratitude, optimism, curiosity, and prepare them for life better than other skills. Even though it's important that we want our kids to go to good college, but it's more important to prepare them for life when they are older, when they are in their 30s and 40s, and they are successful. And Einstein has this quote, education is what remains after one has forgotten one has learned in school. So it's important for us to think about, as adults, what do we remember from high school, right? And what are some skills that really prepare us for our job, for our career, prepared us for life. And keeping that in mind, we also need to understand the challenges kids experience. So just speaking about biology, that for adolescents, their brain is not fully mature. So when does our brain reach full maturity? It's not until age 25 or 30. That means during that time, for most of us have kids and teens, and they are not 25 yet. So the region in their prefrontal lobe, which is responsible for making this good decision, making good judgment, and the planning and assessing for risks. So that area is not fully mature yet. But as adults, we are capable of this top-down regulation of behavior. Our prefrontal lobe will send message to our stratum and to say, okay, even though it's not really fun to play video games, it's also important to go to sleep. But adolescents are not able to do this regulation. So they need parents' help. But parents also need to understand adolescents struggle with this because their reward system is stronger and their prefrontal lobe is not strong enough. So in recent years that we have done some community work trying to understand what do kids and parents think are challenges that they face. We collect data from this Hear Me essay context. So here are some quotes from kids. So kids say that they experience a lot of pressure. And so they say that we are Asian, not Bijan, so that we have to all get A's and not A minus or not B. But think about how much pressure that must be. And so this kid said that when I was in high school, I didn't feel proud of anything because people will say like, oh, you ace all tests. It's because you're an Asian. Then what are you supposed to be proud of? When we are under a lot of pressure and not being recognized for the hard work we put in, and our basic needs are not being met. And sometimes kids also talk about their parents comparing me with other kids, and that make them feel anxious. So as adults, if we have this conversation with another friend or a significant other, you say that I got a promotion today, I will be the director of my unit, and it comes with 1,000 bonus. Then the other person say, oh, only 1,000? I heard Amy got a $5,000 bonus. How would that make you feel? We might not feel good, right? But we do this to our kids frequently. And how would that make our kids feel? So this is another example. The kid's swimming score improved by 2 seconds. Then the dad said, good, but I saw Tom's score improve by 5 seconds. Tom is always doing better than you. You have to try harder. So instead of using that type of communication, and we suggest parents to use more active listening skills. So adolescents in our essay contest say that we really start from our parents is a listening and understanding heart, accepting us and appreciating the way we are. And so they want parents to understand them and to listen to them. One way we can communicate understanding and listen to our kids is using paraphrase. Basically, you repeat or use some words to repeat what they say. So this can help them feel being heard. So for example, you can say, I can understand why this makes you so upset. I've been bored and staying home all the time is getting old to me too. I understand it's challenging. Or you can say, you seem to be pretty disappointed. It's okay if you feel angry right now. And a challenge for us is really to think before we say something. So is this true? Is this helpful? Is this inspirational? Is this necessary? Is this kind? So thinking about, is me yelling, serving my kid or myself? And when I say Tom is always better than you, you never listen. So is that really true? Is it true that they never listen? And also in the essay context, many kids share that parents and the kids, they feel the pressure. And the parents also tend to use this tough love. So parents say that in the old country, in my time, the road to success started with and ended with academic excellence. But this is not the old country, and times have changed. And so even though many of us came to the US because we study hard, but our kids grow up here, and that's not the only way for them to be successful in life. And also our kids face model minority myths, this pressure from the society, and they worry that they are a disappointment to the parents, or they worry that they feel anxious. So this is the same quote that Asian American kids, when they get good scores, they might not be recognized by their peers or might not recognized by the teachers. And so when their academic achievement is not being acknowledged and recognized at school, and when parents do not praise kids at home, they find their confidence, it's hard for them to develop their confidence and ethnic identity. And the third challenge kids mentioned is that parents are not paying enough attention to their mental health. So it's important that Asian parents become aware that mental health is of equal importance to physical health, and dialogue should incorporate emotional well-being instead of solely physical symptoms. So depression is common among teens and college students, and it's even more common during COVID because everyone is under a lot of stress. But the good news is that teens can recover from depression and mental illness. Evidence-based treatment are available. The last challenge I want to talk about is acculturative stress. So there are differences in Asian culture versus mainstream US culture. For example, parents might say, don't question, just follow. You have to listen to me because I'm the parent. Versus at school, kids are encouraged to ask questions and do not just follow. And it's in the school, teachers encourage kids to seek autonomy and independence, but the kids might hear different message. So it's important for parents to communicate with their kids that we are trying to understand them. And so understand that kids might struggle with cultural conflicts, and but we might not totally understand. Like I did not go to middle school in US, so I did not really understand or have no idea that girls can be so mean in middle school. So when parents communicate this to the kids, at least you show them that you are trying to understand them. So here are some examples of ways parents can show empathy. You can say like, I wish you didn't have to go through this. You must feel so disappointed. This sounds so embarrassing. So by you communicating and talking like this, kids see that you are trying to understand them. And because of the model minority myth, kids' achievement might not be recognized. So it's important for parents to recognize their effort. As adults, as well as kids, when we get more positive interaction than negative interaction, when we have this ratio of 5:1, so we hear more positive things and less negative things, we tend to do better. We hear better, we remember things better, we pay attention better. And so it's important for parents to recognize kids' effort and to praise the kids. So here are just some examples. And it's better to praise more specific things instead of more general things. So you might say, I'm impressed by your hard work and searching for this essay. You work hard to master that piece you have been practicing. You must be so proud of you. And the last point I want to make is that we want to express our gratitude. So sometimes you are praising your kids, but sometimes you might be express gratitude. So the mom here say that I'm grateful for my daughter because she's home with me right now during COVID. I'm grateful for my other son who has figured out every possible ways of getting food online that that they can get food online, so they don't have to go to grocery store. And this dad said that my son was interested in watching cooking shows instead of doing his schoolwork. I was really mad. Then I realized that we talk about relationship is important, and I remind myself relationship is more important than schoolwork now. Then the son surprised the parents by making a big meal for the family. So if we only focus on doing well in school or completing homework during COVID, we will miss this good family interaction that kids cooking meal for the parents. Because depression and anxiety is common, and it's important that parents pay attention to signs and symptoms of depression and pay attention to coping skills and teach kids relaxation strategies and the coping strategies. And when there is a need, it's important to seek professional help. And there are mental health providers out there. You can find them by talking to your pediatrician, talking to the school psychologists, school counselors, as well as other mental health service providers in your insurance. And SAMHSA has this website. You can find providers. APA, American Psychological Association, have this website. You can find providers. And there are many other resources out there. And I'm going to stop here first, and we'll have Kate Liu and from Mental Health 360 project at CCACC to share more about different resources in the community, in the Asian American community right now.
Hi, I hope everyone is doing well physically and mentally. I would like to take this opportunity to introduce our Mental Health 360 program. It's a program provide a holistic approach to emotional wellness. The program is hosted by CCACC, Pan Asian Volunteer Health Clinic. The clinic is a safety net clinic, and we are a member of the Montgomery Care, providing medical care to the uninsured and underinsured. Other than medical care, we also provide programs to address health disparities. This program including the Hepatitis B program, the Mental Health 360, the No Pain Initiative program, and some social service assistance and referral program. So most of our provider physicians are volunteer doctors. We also have 2 staff, nurse practitioner staff, and all the other professionals are volunteers. The Mental Health 360 program, it's a very unique program we offer to the community. We know mental health is kind of like a taboo. People don't talk about it, but we do see it in our daily life. So since 2015, organized by a group of community primary care doctor and mental health professionals, we formed this mental health 360 program. So the main service area is we will provide public education, direct service, and we form a service network within the community and the outside of the Chinese community. So we have a service network. And we also do a lot of the outreach activities with University of Maryland, Dr. Zixing Wang's program, and the Parent Association, Chinese Parent Association, and some faith-based community organizations. So we address all kinds of issues related to mental health to different population. So we address aging, mental health, and then stress and work-related mental health issue. And youth mental health is another big focus we have. So in the past few years, we've done quite a few big events to address youth mental health. For example, in 2016, we have our first mental health awareness to raise the awareness of mental health to the immigrant family. So we introduced experts from Massachusetts General Hospital. They have a center address mental health issues to the Chinese youth. So we invite them to come over to have an event, and that was very successful, and many people begin to think about this topic. In 2017, we have this big event called Hear Me Out. You can see the flyer. We encourage community to write about their experience related to the first generation parents and the second generation American born children or teenager, the family dynamic, the conflict, and how they work out the difference. So this event was quite successful, and that set the foundation of our work since then. And since then, we also work with Dr. Zixing Wang to throw out a lot of sections, parenting workshops and mental health use first aid series to the community. We go to the community and meet them at the place so that we can have a good discussion. So during this pandemic, we also provide programs to support family with special needs children. And also we continue to provide workshops, online workshops to address parenting during pandemic. We also provide limited direct service. This service include psychiatric service, counseling service, and family and group therapy. If you have any questions, feel free to reach out to me. And I hope physical health and mental health are all important. And I hope we all take care of ourselves in this special time. Thank you.
Again, thank you for coming to today's talk. And you can find more information about CCACC as well as my University of Maryland program online. And please stay in touch.